Acefdrox 250 Detailed information. Acefdrox 250 is an antibiotic belonging to the Cephalosporin group, used to treat bacterial infections caused by bacteria sensitive to Cefadroxil. The drug is available in an oral suspension form, making it easy to use for both children and adults. 1. Effects of Acefdrox 250. Active ingredient Cefadroxil. Uses treatment of bacterial infections caused by bacteria sensitive to Cefadroxil, including upper respiratory tract infections, pharyngitis, tonsillitis, sinusitis; lower respiratory tract infections, bronchitis, pneumonia. 1. Effects of Acefdrox 250. Skin and soft tissue infections, boils, abscesses, wound infections; urinary tract infections, cystitis, pyelonephritis; ear, nose, and throat infections, otitis media, rhinosinusitis; upper respiratory tract infections, pharyngitis, tonsillitis, sinusitis. 1. Effects of Acefdrox 250. Lower respiratory tract infections, bronchitis, pneumonia; skin and soft tissue infections, boils, abscesses, wound infections; urinary tract infections, cystitis, pyelonephritis; ear, nose, and throat infections, otitis media, rhinosinusitis. 1. Effects of Acefdrox 250. Upper respiratory tract infections, pharyngitis, tonsillitis, sinusitis; lower respiratory tract infections, bronchitis, pneumonia; skin and soft tissue infections, boils, abscesses, wound infections; urinary tract infections, cystitis, pyelonephritis. 1. Effects of Acefdrox 250. Ear, nose, and throat infections, otitis media, rhinosinusitis. Contraindications: hypersensitivity to Cefadroxil, cephalosporin antibiotics, or any component of the drug; patients with a history of severe allergic reactions to penicillin; patients with colitis; patients with severe kidney disease. Cautions: patients with a history of drug allergy; patients with a history of gastrointestinal disease, especially colitis; patients with kidney disease; pregnant or breastfeeding women. Dosage and administration: the dosage and duration of treatment will be prescribed by a doctor based on the patient's condition and health status. Take the medicine as directed by your doctor. Do not change the dosage or stop taking the medicine without consulting your doctor. Dosage and administration: take the medicine after meals to reduce gastrointestinal side effects. Side effects: common side effects: diarrhea, nausea, vomiting, abdominal pain, rash. Less common side effects: colitis, candida infection, anemia, leukopenia, increased liver enzymes, jaundice. Serious side effects: severe allergic reactions, anaphylactic shock, kidney failure. Drug interactions: Acefdrox 250 antibiotic can interact with other drugs, leading to reduced effectiveness or increased side effects. Therefore, inform your doctor about all the drugs you are taking, including over-the-counter drugs, herbs, and supplements. Some drugs that can interact with Acefdrox 250. Drug interactions: cholestyramine reduces the absorption of Cefadroxil in the gastrointestinal tract. Probenecid increases Cefadroxil levels in the blood, which can be toxic to the kidneys. Furosemide may increase the risk of kidney toxicity. Aminoglycoside antibiotics may increase the risk of kidney toxicity. Drug interactions: typhoid vaccine may reduce the effectiveness of the vaccine. Cholestyramine reduces the absorption of Cefadroxil in the gastrointestinal tract. Probenecid increases Cefadroxil levels in the blood, which can be toxic to the kidneys. Furosemide may increase the risk of kidney toxicity. Drug interactions: aminoglycoside antibiotics may increase the risk of kidney toxicity. Typhoid vaccine may reduce the effectiveness of the vaccine. Cholestyramine reduces the absorption of Cefadroxil in the gastrointestinal tract. Drug interactions: probenecid increases Cefadroxil levels in the blood, which can be toxic to the kidneys. Furosemide may increase the risk of kidney toxicity. Aminoglycoside antibiotics may increase the risk of kidney toxicity. Typhoid vaccine may reduce the effectiveness of the vaccine. Other notes: pregnancy. There is no adequate research on the side effects of Cefadroxil on pregnant women. Therefore, the drug should only be used when absolutely necessary. If you find out you are pregnant while taking the medicine, notify your doctor immediately. Other notes: breastfeeding. The Cefadroxil ingredient in the oral suspension is excreted into breast milk at low concentrations. Therefore, caution should be exercised when using the drug for breastfeeding mothers. Monitor the child for signs of thrush, diarrhea, and rash. Other notes: driving and operating machinery. Acefdrox 250 does not affect the ability to drive and operate machinery. However, if you experience side effects such as dizziness or drowsiness, you should avoid driving and operating machinery. Other notes: storage. Store in a cool, dry place, protect from direct sunlight, temperature below 30 degrees Celsius. 3. Diarrhea while using Acefdrox 250. Diarrhea is a common side effect of antibiotics, which may be due to a change in the balance of bacteria in the gut. If you experience diarrhea while taking Acefdrox 250, contact your doctor for advice. 4. Note: the above information is for reference only and does not replace the advice of a doctor. Always consult your doctor before using Acefdrox 250.